we're here to talk about chronic fatigue syndrome today because it is so incredibly related to Lyme disease and Bartonella and other zoonotic infections.
Yeah.
You hear it all the time. I hear it all the time. I feel like people fall between the cracks.
They definitely do, and it's such a variable diagnosis. You know, I get some patients who have diagnosed with chronic fatigue syndrome. I say, tell me how functional you are. What's your daily life like? And some patients are quite well, and I said, I wish I had as much energy as this person. They're like running, and they go to the gym 4 days a week, and but they're tired after work, and the doctor diagnosed with chronic fatigue. And then I get these other patients that they can't even sit up. They have this postural orthostatic tachycardic syndrome that's very severe, and they can't sit upright, and they have to be kind of carried from room to room, and they could barely lift their head. You say, how do we reconcile these two ends of the spectrum? Is this really the same diagnosis, or is it a group of disorders? Are there multiple infections kind of resulting in this chronic fatigue presentation?
Well, I have a question for you.
Yeah.
When somebody comes to you and says, I have just seen my doctor and they gave me a chronic fatigue diagnosis a year ago, 6 months ago, whatever. Based on what? Is it just clinical?
It's just,
or is it a blood test that detects Epstein-Barr? Like, what's the criteria?
So the criteria is clinical, but a lot of doctors do test for Epstein-Barr, and the problem is that 98% of the country has Epstein-Barr.
We all have it.
And Epstein-Barr is a herpes virus, and it never goes away. And it's true that when we run down, it can, the titers of the antibodies
That's what I was
can
going
go
to ask you.
higher.
Can you talk about the IgG versus IgM?
I think that with
people ask these questions, so
my sense with the viral stuff versus things like or bacterial, that I've had a number of patients do powerful antivirals for chronic fatigue syndrome, and there's some data out of UCLA, I believe, that showed that some of these IV antivirals that are kind of toxic can be beneficial for chronic fatigue syndrome. I haven't seen it. I haven't had patients that have done it for months and months and months tell me, "Wow, I'm so much better." In fact, I have not seen personally good outcomes, and I've seen patients do it for a long period of time. I've seen much better outcomes with antibiotics. It's not perfect. There are people with very severe illness where it's very hard to get them better, but not impossible.
So that would tell us the antibiotic usage getting people better, that it's bacterial.
Yeah, of course.
Right, but people don't realize.
Right.
So a lot of people don't realize that bacteria responds to antibiotics and viruses don't.
That's true.
So if you're talking about Lyme, it's bacterial. If you're talking about Bartonella, it's bacterial.
Right.
There are probably a number of other.
So they've done studies, the NIH did a supported randomized controlled trial. It was at a Stony Brook. It was a Krupp study. And they had patients with Lyme who then developed chronic fatigue after Lyme, and they showed that the chronic fatigue resolved with antibiotics and not placebo. So it wasn't just anecdotal. They did an actual randomized controlled trial, and there was an open label, so it's a non-randomized controlled trial out of France where they did long-term various different antibiotics. And these patients were on disability. They were just, a lot of them would meet the chronic fatigue type presentation. And they resolved with antibiotics, and they were saying how they got patients off disability. So, people, I think, can get better from these illnesses. I've certainly seen it. Like I said, there are some very, very difficult cases, but the majority do improve a lot. And, I think that, unfortunately, like any kind of disease community, that sometimes, because we mentioned this before about ownership of your disease state, I think it's sabotaging because it kind of like the investigation stops once you have a label.
Right. If you say like I'm a Limey or I am a blank, right? It's hard on your soul to think of yourself like this.
Yeah.
I thought it was when I was sick. I refused all labels because I thought it was going to make me feel worse.
It's defining, and then it puts four corners around you, and you can't break out of it.
I think it's like when people tell me like that tweet I got. It's our community. It's like it was from a different community, but I'm just saying they were defining themselves and rallying. And while I completely feel part of the Lyme community, and I am here because of the Lyme community, I don't want everybody to just think of themselves as a sick person.
We don't define ourselves by the illness.
Exactly.
It's a struggle. We get, we're attacking this problem, but this is not, what you are, what we are. So let's talk about that documentary, Unrest.
Yeah.
What do you think?
I thought that, first of all, kudos to Jennifer Bray, I think her name is, who did the documentary. She did a gorgeous job.
Yeah, beautiful cinematography.
Beautiful,
Yeah.
and I am heartbroken for all the patients, including her, who have gone through these incredibly traumatic illnesses and are still suffering, some of them, or maybe all of them, I'm not really sure. I couldn't help but think that a lot of very sick Lyme patients look similarly. Identical,
Yeah.
and I was concerned that people seeing this might not investigate tick-borne disease because I didn't hear it mentioned.
It was not mentioned. I was really kind of surprised.
I was surprised.
Yeah, I don't know. I understand. You want to investigate all avenues of what's reasonable, and to look for viral avenues that's reasonable. Like I said, it's just that why not look for the obvious?
Right.
You know.
Well, and then there's looking for the obvious, and then there's ruling it out properly. So that's a huge, huge undertaking. You have to know where to look.
Yeah.
So how many doctors told me they ruled out Lyme and Bartonella when they didn't? 12.
How many doctors failed to diagnose my dad's case over 20 years despite going
30?
to at least the best doctors at all the teaching hospitals in New York City, and then he almost died of progressive heart failure.
So I did too. I don't know if I almost died, but I was in heart failure by the time I got to you. So that was just in a 5-month period. About a dozen doctors told me that I didn't have Lyme and Bartonella. That's because they don't have the ability to properly recognize it and to properly rule it out. They also don't use the correct labs. Not that we rely solely on blood tests, or even a lot, because they're so poor even in the best of circumstances.
But we can talk about this, rationally and say this, but if you talk to a patient who, let's say, they may know people who have Lyme, they may be compassionate to this kind of illness that their friends and family may have, and if you say to them, if they come down with this illness, it's still hard to have it sink in. You don't get it till you get it. Like, they're still going to say, I'm going to go to this doctor at Columbia, or I'm going to go to this doctor at Cornell, and that's a top doctor. And if they say that it's not Lyme, it's going to mean something, because in their mind, there's going to be this kind of bias toward the big name brand institutions. And they're great name brand institutions for heart attacks and strokes and
and there's
cancers
the Mayo
and all these
Clinic.
things.
Everybody with Lyme that goes to the Mayo Clinic doesn't get better, and they go, but I went to the Mayo Clinic, and I'm like, that's probably like the number one complaint I hear is that from Lyme patients, that they've gone to the Mayo Clinic and been sent home with nothing.
Did I ever tell you that I had a patient referred to me from an infectious disease doctor at the Mayo Clinic?
No, you never told me.
It's so funny.
Like an ID doctor called you and said, or the...
No, he referred the patient, he gave the patient my name.
How did he even, not that you're not a superstar, but how did he know about you? Because I know they don't even look on this side of the fence.
Yeah, no, it just happened to be when the IDSA hearings were done in 2009. And that was on the internet. There was broadcast on the internet, and then my written document was like 81 pages long with 226 references, and he got a hold of that, and that actually convinced him that something going on with this.
Jeez, you think? If you look, I read a lot of it. It was the most compelling thing. Your testimony was absolutely amazing. We should post it.
It's not posted?
We should post it along with this video, because people
it's really long. It's really long, and it's very densely written, very hard to get through.
What about your physical testimony?
The video?
The video is amazing.
The video is 20 minutes. They limited the testimony to 20 minutes, so you had to get a lot in 20 minutes. So I spoke kind of rapidly, and then they said, "Well, just write up everything that documents chronic Lyme in 2009," and it'd be in those whole 81 pages. But now there's a lot more, the whole landscape of this debate has changed so much since they show that they can't kill Lyme effectively in the test tube with the only few antibiotics that are kind of canonized by the IDSA as the cures for Lyme.
So
they don't kill it. That's crazy.
That's a problem, because ID doctors told me specifically to my face, the reason why we know that you're cured and why you don't have ongoing Lyme is because it's killed effectively in the test tube 100% by doxycycline in like 10 days.
Except that's not true.
I know it's, well, now I know. At the time I believed it because I was at NYU with a top ID doctor, and then I went to another one, and then I went to a third one.
So for the public?
Yeah.
So doxycycline, Rocephin, which is the IV, amoxicillin, Ceftin, these are the drugs that are recommended by IDSA for the curative treatment for Lyme, and none of them effectively kill it in the test tube. There are about 30 articles where they found Lyme alive in patients, human patients, after antibiotics, even long-term antibiotics, even up to about 2 years of antibiotics. There was a case of a lady who they cultured out of her knee. She did knee surgery eventually, and she had done about 2 years of antibiotics, both intravenous and oral.
And they cultured live spirochetes from her knee.
Live spirochetes, yes. And it was a North American patient. And that's not the only one where it's been many months. There are cases of 9 months of antibiotics with it cultured alive. Well, so, having said all of that, you would think it's obvious, that it would be easily accepted. You would think, but that's not how it works. I mean, we talked on prior videos about bias, and people kind of want to see what they want to see. And the fact is, you just don't get it until you get it.
So I have an idea.
What?
Why don't a bunch of ID doctors who don't believe us and don't believe the data inject themselves with Lyme, like the H. pylori guy? Inject yourself with Lyme and Bartonella. Give yourself 2 to 4 weeks. Let's give you the whole 4 weeks.
That's a great
let's
idea.
be so generous. But first, they should wait a couple weeks for the Lyme to disseminate. I think it's important for it to go, completely systemic. Then take the month.
I think that's a great idea. People talk about that all the time. If it was so easy to cure. So it's an open challenge to IDSA doctors or doctors who don't think that Lyme is a big deal and Bartonella is a big deal, to give yourselves Bartonella, wait a few weeks.
And your kids. Why not give it to the kids too? Give it to the whole family. And
but the argument is then that they don't want to develop post-Lyme syndrome, that it's not Lyme anymore, but post-Lyme syndrome is a recognized effect. And
let's see how they decide to treat it once they understand it better from a personal perspective.
Well, I can tell you from my experience in treating patients, and we've said this on, I think, prior videos too, I've treated over 100 doctors who come to see me with chronic Lyme and chronic Bartonella. And they don't treat themselves with a month of antibiotics. The doctors that come to see me have been on many months of combinations and aggressive antibiotic therapy. And the large majority of those doctors are not Lyme doctors. They won't treat chronic Lyme, even though they themselves had treated themselves aggressively. So,
they won't treat it because they don't want their feet to the fire, right?
Nobody does. Nobody wants to be.
Only you.
No, I don't want this. I fell into this, and
this is a calling.
It's a calling,
We need more.
Yeah, so it's a question of, do you want to ignore what's obviously true? What's obviously the right thing to do? It's not easy. I mean, but there are studies on how long it takes for medical dogma to change, and it takes decades. And I think things have changed a lot, believe it or not.
And I think they would change more quickly if ID doctors took your open challenge. And they could evaluate their own aches and pains of everyday living and see.
Right, it's just going to be compatible with aches and pains of everyday living, right? Yeah, it's going to be great. Yeah, that'll never happen. But the fact that it doesn't happen means that there's a real issue going on. I mean, the H. pylori guy, he drank down a solution of H. pylori.
Yep.
He proved that ulcers were caused by H. pylori, and resolution of ulcers can happen with antibiotics. And,
And everybody discounted him and called him crazy before all that and said that was...
Until he did that, right.
Right, until he proved it himself.
And he changed the whole paradigm of ulcers in a really short period of time, like that.
Right, exactly.
And unfortunately, we don't have something to change the paradigm of this chronic Lyme. But
well, we're gonna still keep plugging.
Yeah, I think what will change it.
What?
A cure.
There we go.
And that's what we're working toward. I don't like to use that word, but something curative, nearly curative, something that'll be a game changer treatment.
There we go.
That would change the paradigm.
All right. Well,
because if you can take people with post-Lyme syndrome, quote unquote. I always hate when people do air quotes and I do them because I don't want to come on this video that I'm in favor of the term post-Lyme syndrome because I think it's a terrible term.
Well, let's just
hate
make
the
sure
term. Hate the term.
Hate it.
Post-Lyme syndrome.
Don't say it.
It's one of these things that also puts people in a label and doesn't represent what's going on.
It misinforms treatment.
Yeah,
if you think it's post-Lyme, you think no more treatment.
Right, no more treatment. I think post-Lyme equals persistent Lyme and persistent
100%.
Bartonella. Right.
Agreed.
So.
All right, so we covered some good ground today. And,
I think so.
Chronic fatigue. If you have more questions, post them to us, and Dr. Phillips will answer.
Thank you, guys.
To the best of his ability. Thanks.
Take care.